For those looking to expand their family, the pandemic and rollout of the vaccine has created a lot of questions and concerns. I spoke to Dr. Jennifer McIntosh, an OBGYN with Froedtert in the Medical College of Wisconsin, about the vaccine and pregnancy.
COVID-19 in pregnancy is risky. We know that women who get COVID-19 while they're pregnant have an increased risk for preterm delivery. They have an increased risk for being admitted to the ICU and having much severe disease, about 3 times the general population, and about 2 times the risk of dying from COVID-19.
For those who are normal, healthy women who are looking to get pregnant in the next year or so, what's your recommendation as far as getting the vaccination?
If they are able to get the vaccine, they should absolutely get the vaccine. There's no reason to delay pregnancy after the vaccine. In fact, getting the vaccine before they get pregnant would be the safest way to protect their pregnancy against COVID-19.
Why don't we talk a little bit about for those who are undergoing like fertility treatments?
There are some rumors that suggest that the COVID-19 vaccines could somehow impact fertility, and that's false. Many national societies have spoken out and debunked that myth. There's also been some case reports that babies who are born to moms that get vaccinated have that immunity as well. So you have the potential advantage of passing immunity to COVID-19 to your baby, which is a huge plus because right now children can't get vaccinated. We have no reason to believe that the vaccine should be problematic for women who are breastfeeding.
What does the conversation then look like if you have a patient who says, I'm really not comfortable taking the vaccine, I'm in the first or second trimester? What is your recommendation then?
We know that there's increased risk to pregnant women who get COVID-19, but it is a very patient-centered conversation, right? We are by no means pushing pregnant women that they have to be vaccinated. It is a personal choice. We talk about the risks and the benefits, and we make it a very patient-centered choice.
And Dr. McIntosh advises if you choose not to get the vaccine, you should quarantine as much as possible and, of course, be diligent with that mask wearing as well as social distancing.
And with the next eligibility group announced in Wisconsin today, pregnant women will be eligible for their shot starting March 29th.
You've waited for that.
Yeah, a long time. I didn't expect this.
The long wait to hug a loved one. Vaccines offer opportunities for long-awaited reunions. That part of our story and the concern from doctors about letting our guard down too soon when we come back.